Hello, my name is Shay Hebert, and today I will be talking about adjustment disorders. A quick overview of what we will be talking about in this slideshow is what are the key factors that define adjustment disorders, what constitutes having an adjustment disorder over other trauma or stressor related disorders, and why is it so important to have specifiers and modifiers present when listing a trauma or stressor diagnosis. Some of the key factors of an adjustment disorder diagnosis are the development of symptoms, how often those symptoms occur, and the potential effects that those symptoms might have on a client's life. Under the development of symptoms, once a stressor occurs, a stressor being a significant emotional event within a client's life, development of disproportionate marked distress over a stressor that occurs within a 3-month or less time frame. This causes significant social or occupational impairments. A stressor can be defined as a single event occurrence, for example, a breakup, or multiple stressors from a prolonged event, for example, a drawn-out divorce proceeding. Since stressors can be recurrent, the behavior may affect not only an individual, but their entire family, or in the case of the aftermath of a natural disaster, it could affect a whole community. Our next question was, from a diagnostic perspective, what constitutes having a diagnosis of adjustment disorder more than any other trauma stressor-related disorder diagnosis? Adjustment disorders can be diagnosed immediately following a traumatic event and persist up to 6 months after the exposure. Whereas acute stress disorder can't be diagnosed unless there are symptoms 3 days to 1 month after the stressor, and post-traumatic stress disorder, or PTSD, can't be diagnosed until at least 1 month has passed after the exposure to the stressor. Also, the symptoms between acute stress disorder and post-traumatic stress disorder and adjustment disorder are also different in that adjustment disorder cannot exceed the post-traumatic stress disorder or acute stress disorder criterion threshold for symptoms. And last, because adjustment disorder can't persist for more than 6 months without the diagnosis needing to be changed, then the symptoms that fall short of the post-traumatic stress disorder and acute stress disorder threshold should be diagnosed as another trauma or stressor-related disorder. Our last question for our project was, why is it so important to have specifiers and modifiers present in listing any of these diagnoses for trauma or stressor-related disorders? Specifiers list additions to the diagnosis, like whether there is also a presence of depressive mood or anxiety. It also lists whether there are behavioral violations of others, also known as disturbance of conduct, or the presence of mixed emotions. It also can list the duration of the symptoms. For example, if there is one occurrence, it may be an acute type, but if it is happening repeatedly over a prolonged period of time, then it could become chronic. Unless there is a prolonged stressor. Another thing that a specifier can do is if the therapist feels that they need to leave it unspecified. An unspecified specifier is needed when there are symptoms caused that are not related to any other types, such as physical symptoms. Specifiers and modifiers help to provide additional details about a diagnosis so that a therapist can form independent treatment plans that are the most sufficient for the client to use to get back to normal functioning. A few of the references that I used were the American Psychiatric Association DSM 5 revised, and the majority of my content was pulled from page 34 over the specifiers of adjustment disorder, and also on page 319 where it goes into depth about adjustment disorder. Another reference that I used and pulled information from was from Medical Central on YouTube under the video labeled Adjustment Disorder, Everything You Need to Know at the minute marker 2:26. I pulled some information from there. I hope you guys enjoyed this video and found it informative, and it was fun to make. Thank you.